Welcome to the Daily Brief on Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College of Wisconsin. Each day at 3:30, we deliver this fact-filled 19-minute update on the health and economic impact of COVID-19. The webcast is powered by Aurora WDC. And today, we're joined by our special guest, Nancy Hernandez, president of the Hispanic Collaborative, which is dedicated to improving the economic opportunities and representation of Latinos in the region. So as we do every day, let's start with our update, and it looks like an improving scorecard from Dr. Raymond.
Yeah, thanks, Tim. Why don't we go ahead and go to the scorecard slide, please, Eric? As you know, over the last 3 weeks, we've been tracking the efforts of Wisconsin and the Milwaukee region to flatten the COVID-19 curve. And we've seen steady improvement in that daily growth rate of new COVID-19 cases and in the calculated doubling rate. And that favorable trend continued today. As of 2:30 today, there were only 33 new COVID-19 positive tests in Milwaukee and 87 in Wisconsin. The daily growth rates improved again to 8.8% in Milwaukee and 9% in Wisconsin. 3 weeks ago, the growth rate was nearly 35%. The doubling rates also improved again to 7.9 days in Milwaukee and 7.7 days in Wisconsin. And recall that 3 weeks ago, the doubling rate was faster than every 3 days. In terms of what we've done to flatten the curve, Wisconsin currently ranks in the top 10 of performance in flattening the curve of all the states in the union. And I'm tremendously grateful for the work that's been done and the many sacrifices that all of you have made so far to help us flatten the curve. Now, because it appears we're stabilizing the spread of COVID-19 in our state, and that we can begin to have discussions about when and how to responsibly restart the sectors of the economy, I'd like to focus a little bit more on that. I do need to emphasize that the doubling times and new case rates have been very important measures of the effectiveness of social distancing. Our improvement has been encouraging, and I believe it has saved lives. But the improvement does not mean that it's prudent to remove all social distancing interventions. We cannot yet declare victory. On the contrary, we've dodged a bullet, but we must understand that the gun is still pointed at us and that there are more bullets in the chamber. And if you look to the south in Illinois and Iowa, you'll observe there are other guns that are pointing at us as well. So we need to acknowledge that reality and to prepare for the likelihood that when we loosen some of the social distancing restrictions, there will be an increase in new cases and possibly an overwhelming surge if we're not thoughtful about how to reopen the various sectors of our economy. We need to get the balance right. Next slide, please. Now, anticipating reopening sectors of our economy, there is an ongoing national discussion about what's needed for a measured and responsible restart. This slide shows some preliminary consensus indicators for your consideration. First, we need to see a sustained reduction of new cases for 2 weeks. That's consistent with what we know about the biology and the epidemiology of COVID-19. And we recommend that the clock should start no sooner than yesterday, due to concerns about relaxed social distancing over the religious holidays this past weekend. Second, we need to be able, at a bare minimum, to test all people with COVID-19 symptoms. Third, hospitals need to be able to treat all patients requiring hospitalization without resorting to crisis standards. Fourth, we must have adequate personal protective equipment available for frontline healthcare workers, first responders, and the workers in the reopened sectors of our economy before we can restart. And fifth, we must be able to count, trace, and monitor all COVID-19 cases and their contacts in real time. Now, as of this moment, we have insufficient information about the reduction of cases, but we do know that the 4 indicators on the bottom are still in the red. Next slide, please. This slide shows a proposed checklist for a smart restart of our economy. The checklist would include all key health and safety indicators being green and a phased reopening that starts with low-risk sectors of our economy. We also need to identify and socialize health and safety best practices for each sector and to educate our workforce and to prepare them with the tools that they'll need to safely reopen. And we need to prepare for and develop contingency plans for flare-ups of COVID-19 as the restart begins, because there will be flare-ups. The COVID-19 virus will continue to silently stalk the human race, looking for opportunity and any lapse in our vigilance. Now, all of this will require thoughtful and deep collaboration amongst business leaders, our government, the health systems, and public health leaders. Next slide, please. As a final reminder, we must all continue to practice voluntary social distancing for the foreseeable future until such a time as we've extinguished COVID-19 completely or until we have an effective vaccine or preventative treatment. Now, this sign from a USPS building in Massachusetts, I believe, says it all. Can we go to the next slide, please? Finally, on this last slide, I'd like to draw your attention to a list of recommended hot links, which we will provide you from time to time. These slides and the hot links can be downloaded in PDF form in the chat pane. So thank you for your attention, and I'll turn it back over to Tim.
Great. Dr. Raymond, before we pivot to Nancy, and I'll bring her back into this discussion in terms of the Hispanic and Latino community, what you've really set up for us here, I think, is, my analogy would be, we're looking at the start of a race. We're going to restart the economy. And you've shown us kind of the red, yellow, and green lights that we're going to go through as we kind of start those engines back up. And you've also given each of the business people, in a sense, as drivers of their own car, a checklist to go through as we kind of count down those lights. So I think this is a really effective way to communicate about how we can, as soon as the green light hits us, how we can come out of that gate in a very safe, effective manner.
Yeah, thanks, Tim. And also, I want to thank you and your colleagues at the MMAC for really helping us to be focusing our efforts on how we can safely restart the economy.
So this is less about a specific date than it is a process that gets us to the point when there are enough green lights that we start up.
Right. Let's look at the checklist and all the must-haves, and then the dates will take care of themselves.
Thank you. Nancy, I would like to pivot and discuss with you a little bit what you're seeing happen as the COVID crisis has rolled through the community, what you see in the Hispanic and Latino community, and how this is impacting that part of our community.
Thanks, Tim. Yes, happy to share what we're seeing, but also, how can this audience help us with this situation and kind of make it safer for everyone? So I know, as Dr. Raymond has pointed out in previous briefings, we continue to see, and will continue to see on the county dashboard, the near south side continues to be an area where we have a hot spot or are seeing a higher number of confirmed cases. This is a part of the city that has a high number of Hispanic and other immigrant populations. It is one of the densest neighborhoods for families and children in the state. There are a higher percentage of households that have non-English dominant speakers. And if we look at where the concentration of these individuals are employed, it's in food service, food prep, light industrial, and construction. So all parts of our economy that may still be working as essential businesses. So that means we have more people who are in need of being out and about to support the rest of us, and more people that have limited proficiency with the English language in that near south side. So if we couple this picture that I just painted with the fact that Spanish language information during this crisis has either been lagging behind English language information in availability, in some cases by several days, and in many cases it might not exist, it's easy to see why we are unnecessarily dealing with a crisis within a crisis right now in this community. So I want to turn us to what can we on this audience do about it. And I was listening to a webinar this morning where several panelists spoke about the importance of over communicating. This is a point that I can't stress enough. I think we have to intentionally ensure that we are over communicating with our Hispanic population, as well as with other demographics that are experiencing similar issues. On the Hispanic Collaborative website, mkehc.org, you can also access us via the MMAC website. You'll find Spanish language information and links that you can share with your employees about best practice, social distancing, symptoms. Those are just to mention a few of the items that you'll find there. And I ask that if you do have a Hispanic workforce, you become part of the chain of communication and ensure they know how to, for instance, safely enter back into their home after work, or even what social distancing looks like in a grocery store. We are currently also working on pulling together a more comprehensive toolkit to include videos that we hope you will consider sharing with your workforce. So feel free to email us if you have specific needs or questions. We will assist where we can, and you can find our contact information on the MMAC website. The last thing that I'll share is now more than ever, it's imperative when we're dealing with the issue of human life that our method of communicating with our workforce and stakeholders include the ability to share information in English as well as Spanish simultaneously. Regardless of your current processes or resources in place, we know that this is something that can be done, and are happy to help you think about this process in your organization as you communicate with your workforce, customers, and stakeholders to keep them safe. So this is, again, something, email us. We're happy to share this process with you. We will also make it available on our website as a rapid translation method for folks to consider.
Very helpful, Nancy. I know you've also been doing work to help companies take advantage of some of the federal programs and the PPE. You want to talk a little bit about that? I'm sorry, the PPP, too many P's in these acronyms here. But you want to talk a little bit about how you've been helping Hispanic businesses?
Yeah, absolutely. So immigrant businesses represent about 25% of Main Street businesses, and certainly up to 50% in some sectors. So it's a very important part for us to keep in contact with, keep alive as part of the whole fabric. We have been doing some Spanish language webinars specifically. You can find those both on the MMAC website and the Hispanic Collaborative website, and you have the recordings of those. So we have one that's done bilingual that walks small businesses through in English and in Spanish, a step-by-step of how to fill out the EIDL, as well as the PPP. We've gotten a lot of emails already from small business owners that said they use that to submit their information. So we're happy it's helping, and people should feel free to utilize those resources. And we continue to have these webinars each week over key issues that will benefit from Spanish language dialogue. And each time we do, we will post those on the website as well.
So your message would be, si se puede.
Si se puede, you bet. I knew we're rubbing off on you, Tim.
You are. So I'll bring Dr. Raymond back on, and we'll go to questions. Chris, we've got some questions from the audience.
We sure do. Dr. Raymond, first question we got was about Wisconsin's apparently relatively high hospitalization rate, which I believe is from the Johns Hopkins University website. Are you aware of that, and how would you characterize that?
Good question. There are two possibilities. One is that because we haven't been overwhelmed, that we're able to admit patients that maybe have lower acuity illness than they have in some of the communities where they're triaging very, very sick people home. The other is that we've been unable to test as many people as we should be compared to these other communities, and that our incident rate's higher. And if there are 3 or 4 times more people out there in the community that have positive tests than we know about, then our hospitalization rate might be down in the same range as we have in other communities. Right now, it's one of those two. We're really not sure which one.
Dr. Raymond, another question. Are we able to yet tell any effect from the in-person election?
Not yet. We wouldn't normally expect there to be a spike if there was inadequate social distancing from the in-person election till about a week out. And as you know, we usually have a lag in reporting data over the weekend, so we always have caution about Monday's numbers. I think tomorrow and Wednesday will be very telling. Although I have to say, I believe that the people that set up the voting stations were very thoughtful and diligent about trying to make sure that it was easy for people to wash their hands, to have a clean pen to vote with, to maintain social distancing. I think the voters were highly motivated to do that. To be honest with you, I'm actually more worried about the relaxation in social distancing with extended family gatherings that might have happened over this past religious holiday weekend. And so we really need to wait a week before we decide whether there's been a bump from either one of those.
Yeah, Nancy, that's a good question for you. What was the reaction within the Hispanic community, either to the in-person election, because I know civic engagement is an important part of the Hispanic Collaborative's mission, and also Easter?
Yeah, so definitely both of those, you see similar things that you're seeing in the other community. I think that the Hispanic community in particular, two locations that were close to them to go vote, both of those heavily trafficked, as much social distancing as you were able to see in that, but certainly not a fun situation for anybody. Glad to see that people exercise their right to vote, but not necessarily, but definitely feel for what that cost them to do that. So a lot of concern that we heard about that, and certainly the community tried to get out as much information as possible on it. With the Easter, I think that you see similar things. I heard of less community or family to family gatherings in that. I think this is where having multiple generations under one roof potentially helped us and limited the amount of traveling and household to household interaction that needed to take place over Easter. Hopefully they were all under one roof to begin with and were able to celebrate that way.
Dr. Raymond, do you know, is the Milwaukee Health Department or any other organization tracking assisted living or nursing home deaths specifically, like some other communities are? If not, how would you characterize that population's risk at this point?
I think the risk is higher in any situation in which you have high frequency, high density human interaction. There's a higher risk. We would need to ask Dr. Kowalik about the health department. I'm not sure specifically what they're following. I would guess that they are.
One last question. When it comes to potential flare-ups in the future, are there lessons we can take away from other countries that have already gone through a second wave and how they reacted?
Well, we'd like to learn those lessons, but there aren't many countries that have had a surge that exceeded the capacity of their health systems and then have recovered. So we're not right at the lead, but we don't have many examples to draw on from people that have successfully implemented a restart. You know, the countries we talk about, maybe China, we can't really rely on all the data from there right now. And Italy and the rest of Europe still are in the throes of trying to recover from their surge.
Great, thank you. Dr. Raymond, everybody who sent in a question.
Yeah, your checklist, Dr. Raymond, I think would be good for any country if it's going to restart to go through as you look to how to prepare.
Yeah, thanks, Tim.
Yeah. So, Nancy, thank you very much. Dr. Raymond, again, you'll be with us throughout the rest of the week. Tomorrow, we've got Near West Side Partner CEO Keith Stanley, who can talk a little bit about that community and the hotspot that's occurring there. On Wednesday, we've got Peggy Williams-Smith, CEO of Visit Milwaukee, who can talk about hopefully restarting the economy in our hospitality industry. On Thursday, we've got County Executive Paul Farrow, who's also one of the co-chairs of M7, to lend his perspective. And then we'll wrap up the week with case trends for the week and Mayor Tom Barrett as we close out on Friday. So again, thank you all for joining us. And again, thank you for the Medical College and your partnership. Have a good afternoon.
Thank you.
Thank you.